Hello everyone, I'm Ellie Burns.
I'm Jane Cuglietta. I'm a physiotherapist here at Thrive, and I'm a physiotherapist on the Botox team.
So on our team, we have an occupational therapist, a physiotherapist, a physician, pediatrician locally in the community, Dr. Zufelt, and his nurse.
I met Ellie just before her first birthday, I believe. So we have been working together since, for 4 years.
Well, we got pregnant. Mike was still in school for optometry were you in your last year?
Yep.
And we found out we were pregnant, and then we found out we were having twins, and everything was kind of going smoothly. They were the kind of twins that they were a little bit more nervous about. Like, they didn't want me. He had an externship in Atlanta, and I couldn't get insurance to go over there because of the type of twins they were. I think it was just a little bit more high risk. But the girls were born at 23 weeks and 6 days.
When they were in the hospital, because they were in the hospital for a few months, there was a million different diagnoses. Like, every day there was something new, where it was like, oh, this is the new development, or this is the new thing that's come up. This is the new thing we have to worry about. This is the new, ominous threat. And so there was just weeks and months even of that. For Ellie, she did have a brain hemorrhage, basically some bleeding in her brain, which they said was essentially catastrophic. And they said she would have no quality of life if she survived. They painted a very bleak picture for us, but we wanted to push ahead, and whatever happened to her, we wanted to be there to love her and take care of her.
So Botox is really a novel therapy for muscle spasticity, and muscle spasticity is when you have is a problem that people get from some type of injury to the brain at some point, maybe before birth or a stroke, and it can affect any age group. In our clinic, we're dealing with children. The vast majority of the children have cerebral palsy, which is an injury to the brain before birth, something that happens before birth, and it results in spasticity of various muscle groups, either in the legs and the arms or all of the muscle groups, where the impulses to these muscles are damaged, and they have basically muscles that don't relax well.
Ellie has cerebral palsy, and so I feel like most people would just assume that means she's some kind of special needs, when it's really, such a diverse spectrum of, what different needs you can have. For Ellie, she has problems moving her legs and supporting her weight on her legs, and she can't use her right arm as well as her left. And so there's basically motor issues that fall out from that. Cognitively, she's very, very normal, even above normal 4-year-old. She's very talkative, a little bit dramatic, lots of fun, lots of imagination.
My biggest dream is to have so many friends.
We were in Kitchener-Waterloo, and we moved back to Sault Ste. Marie when they were around 6 months old, and I think we got right involved with Thrive.
Botox is most helpful for children with cerebral palsy, and it's used to address muscle tightness and to help create muscle balance. So kids who experience spasticity or dystonia because of their cerebral palsy, which just means that some muscles are tighter and turned on more often, they benefit from Botox to loosen up some of those tighter muscles and to help the other muscles work well. So Botox helps create muscle balance in that population.
So to become part of the Botox clinic or to receive services from Botox clinic, children are referred by their core therapist, PT or OT. They would come in and receive an initial assessment, and then the team together would make a decision as to whether Botox would be beneficial for that client. If they are wanting to move forward, the team and the family decide, and they would be booked in for an injection the following month. And then they would receive follow-up from the clinic 3 to 4 months down the road for reassessment to determine whether they need further injections.
I believe Ellie started with Botox in late 2016, I want to say. So that'd be almost 3 years since she first had her Botox.
Botox has been great for Ellie, I think. Especially, they do such a big assessment before every round of Botox to make sure before going ahead, it's not just like a set amount every time. Like it's basically always different because they're going with where she's at.
So there's some muscles that are turned on all of the time, and that makes movement difficult, that makes caregiving difficult. So Botox, when it's injected, creates a temporary weakness or looseness in the muscle, and that helps us get in there and work on the opposing muscle group that has a hard time working because the other muscle is so dominant. It gives us that window where we can get in there and strengthen that opposite and create more functional movement patterns or improve the ease of caregiving.
The purpose of the Botox is to relax these muscle groups that are stiff all the time. Okay, so what that allows us to do is stretch out the muscle. So if a muscle's stiff all the time, then it can shorten and it won't grow normally, and then it can shorten and become permanently short, and we call that a contracture. And when you have a contracture, that muscle is permanently shortened, and you wouldn't be able to, say, if you had a contraction in this muscle, you wouldn't be able to stretch your arm out. Okay, so in a child with a contracture of the biceps muscle, you wouldn't be able to straighten your arm. Okay, so if we inject that muscle, then that allows you to do more stretching, and it allows the muscle to fully relax on an ongoing basis. So what it does is it gives you this opportunity to stretch the muscle out and make sure that it doesn't shorten. Okay. And over time, we know from studies that it can put off and even prevent the need for surgery.
On a practical level, I feel like Botox clinic for her means there's a lot less rigidity of her muscles. She's able to use her right hand more and open it up more. It's less kind of,
tight.
Her wrist will be less tight. She can actually have a little more flexibility. It means she can sit a little more comfortably. She looks less kind of arched back. It means that she can
walk better.
She can walk better, walk with a lot less kind of rigidity and walk a lot more freely. Makes it easier to put on her coat and get her arms stretched out to get her right hand through the sleeve. It's, on a very practical level that you can tell a couple weeks after Botox when it's like, yes, this is so much nicer than it was a month ago when she was, getting to the end of the efficacy. On a practical level, we really find it does benefit. Apart from the assessments that they do, where it's nice, to have our physiotherapist say, this number has improved for Ellie, this number has improved. That's all well and good, and I'm very happy about that, but it doesn't mean anything really for us. So it's nice to have some actual tangible benefits that we can see.
The process of Botox injections is challenging for kids. It can be very painful. And so that appointment is hard for kids and families, but we have a really, really impressive group of kids and families who make that appointment the best that it can be. And we do our best to play music and to do whatever we need to do to make the appointment as enjoy or make it as okay as it can be for them. But the process of injections itself is definitely the most challenging part.
We do not actually administer the Botox therapy here in the center. Botox therapy is administered by an injection, and that's the only way that you can get it into the muscle in a way that's effective and safe. That's one of the downsides of it, and it would be great if there was another way of doing it. But at this point, that's how it is administered. So we do that when we do the injections. We do not do them here at the thrust center because we do not want children sort of linking Thrive with this, which can be a bit of an aversive experience for them. So we do the actual injections at the offices, the pediatric department at the group health center. We have a special room there that is put aside for doing procedures, and we have one or two nurses that can assist us with that, and both our occupational therapist and physiotherapist attend that as well. And we give the injections there. And that way, and children tolerate these things pretty well, but that way when they come to Thrive, they never have to worry or fear that they're going to have a painful experience here. And we feel that's important, that this is a safe place for children.
I think that it is nice that Thrive and the injections happen at separate locations, because Ellie does now associate the group health center with needles. That's the needle hospital.
She knows as soon as we pull in.
She knows as soon as you pull in for any reason. Are we getting Botox? She kind of freezes up and says, "Am I getting needles?" Whereas when we come to Thrive, it's nice because she now knows, I'm going to Thrive. There are no needles at Thrive. It's just play. Games. Yeah, just play. And so it's much
nice
more.
That it's well, because we come here a lot, so it's nice that she can come and feel safe and know that just fun things happen at Thrive, and she just gets to play and get to see the people that she sees all the time, and that can be a separate place for her, especially while they're so young, and needles aren't a fun thing that it is somewhere else.
You don't have to be scared because it's when we play so many games.
I always tell Jamie and Mike that I don't actually do anything. They are the ones, and Ellie are the ones who have done everything. Ellie teaches me things every day that I'm with her. She's very motivated. She has this wonderful imagination. She's very positive. Put her hands on the chair. There we go.
With my help on my hands, I'll be able to do it.
You're right. Okay, ready, set, go. Up, 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 up. And Jamie and Mike always teach me a lot too in terms of their outlook and their support of Ellie, and so absolutely, I think that they've taught me a lot, and I think probably, I've just played such a minimal role in helping Ellie forward because of everything that they do for her. They're such a wonderful, supportive family, and Ellie is such a wonderful, bright, driven little girl that, they don't need all that much from me. They're just so wonderful and capable on their own.
I think when you're thinking about your children's future, everyone wants the same things in the sense of you want them to be kind and respectful people as they grow up, but then there's a couple more things we think about for Ellie more so than we do for our other kids, in the sense of will she be able to get a job, and will she be able to have enough independence to live on her own somewhere and take care of herself, and get married one day and have kids and all that stuff. It's stuff that you hope for her, and hope that that's a possibility.
Yeah, I think ultimately our goal for Ellie is that we want her to be able to do whatever she would like to do.
Whatever brings her joy, we hope that
she's capable. And so we feel, she may not pursue certain things because of her mobility, and if she's okay with that, that's fine. But we want her to be able to live a good life and be happy and pursue things like a satisfying career, living independently, finding somebody to be with, all those sorts of things, which I guess you just want for all your kids. But you take it a little more for granted sometimes, I suppose, with certain kids. But for Ellie, we just want her to have a normal life and a happy life and happy childhood, and Yeah, all the normal things a parent wants for their kids, I guess.
If Thrive was unable to provide Botox therapy and all the assessment and skill that is needed, the professional input from the physiotherapy and occupational therapy, then people would have to go elsewhere. And almost certainly people wouldn't be getting it assessed and getting it on a regular basis. The only other option would be Toronto or London or one of those clinics, which would also be difficult because I don't think there's any clinic that isn't sort of at their max in Ontario. And the best case scenario, given that it's something that has to be assessed frequently, you'd be traveling to someplace distant like every 3 months or more frequently. So that's obviously not optimal. My suspicion is a lot of kids would just end up not getting it because I'd think the challenges to regularly going far distances and the difficulty for those programs to incorporate new patients would be such that I'd say a fair percentage of the children would probably just not be getting it, which would be a shame. It's really an honor to be able to help them because they're a tremendous group of kids and the families as well. So that's the best part. They have a tremendous number of challenges that we can't even imagine when we don't have those type of issues. They deal with them in an extremely brave fashion mostly, and the key is that they can, once you get to know these families and children, they can be very, very rewarding to know them. They often are very resourceful, but they really need and benefit from the services we can offer them through Thrive.
Just remembering when doctor said that she wasn't gonna do much, like she wasn't gonna be much or have much quality of life, like just remembering that and all the little goals that she reaches is just, it's so much bigger than we even think it is because they said that she wouldn't do any of that. So I think I'm just so proud of how hard she works and start to cry.
In the long run, these services, make these kids like really integral parts of the community, and they often do very well. And in the long run, through optimizing their management here and their development, in the long run, it's just so beneficial for society and the families and the children that, there can be no doubt that every dollar spent in Thrive benefits us with at least $10 worth of benefit.
Like any sort of device or anything she uses, like her wheelchair, her walker, her stander, her orthotics a few times now.
Her bike,
her bike. They've coordinated all that. They've, taken care of funding. They've taken care of getting it ordered and getting people in here to fit her for it and to assess how she's doing with it and to decide when she needs a new one, which has been keeps it so simple. It's just like, there's an appointment with the orthotics clinic at Thrive. You go to Thrive. She has physiotherapy at Thrive. She has a seating clinic appointment at Thrive. It's just, you go to Thrive and everything is taken care of.
Or like when they were having trouble with moving into solids when they were babies, like there was someone that we could see here as well. And just kind of any problem we had, we could come here for any of the issues that we were having.
We work with kids and youth who have incredible drive and endless possibilities. They're a treat to work with, and they have all kinds of things that they can do and they're capable of. It's our job just to help them along that road and to help them meet their possibilities.
Goodbye.